Our next topic is emerging and re-emerging infectious disease. Emerging infectious diseases are infections that have recently appeared within a population or those whose incidence or geographic range is rapidly increasing or threatens to increase in the near future. Example of emerging infectious disease is COVID-19. While re-emerging infectious diseases are a reappearance of infectious agents whose incidence had significantly declined in the past, but whose incidence of disease has reappeared. Example of which is the poliovirus. Examples of diseases, we have influenza, MERS-CoV, Ebola virus disease, Zika virus disease, measles, polio, and COVID-19. In response to emerging and re-emerging diseases, Makati Medical Center created the Pandemic Influenza and Emerging Diseases Emergency Response Team, which is composed of different task force from the different departments of the hospital. So they created a manual, which is the Pandemic Influenza and Emerging Diseases Emergency Response Manual, which was developed to serve as reference documents for MMC medical staff and employees in the event that there is a threat of pandemic, influenza, and emerging diseases. PDER is headed by our medical director and co-chaired by the Infection Control Committee chairman. PDER has 4 task forces, so we have the information and education and communication, hospital operations, emergency response, and surveillance and isolation. We have screening posters of emerging and re-emerging diseases that we use in the hospital. So we have one for MERS-CoV, we had one for Ebola, and for COVID-19. So now let's focus on COVID-19. So what is COVID-19? COVID-19 is an infectious respiratory illness caused by a new strain of coronavirus. So its official name is COVID-19 and the causative agent of COVID-19 is severe acute respiratory syndrome coronavirus or SARS-CoV-2. So how is it spread? COVID-19 is spread through the air by coughing and sneezing, through close personal contact, through touching contaminated surfaces, then touching your mouth, nose, or eyes. COVID-19 is transmitted from person to person by a droplet, direct contact, and contaminated objects. It is transmitted when an infected individual talks, sneezes, or coughs, producing droplets and saliva containing the SARS-CoV-2. These droplets are then inhaled by susceptible individual. COVID-19 transmission usually occurs among close contacts, including family members, and healthcare workers. The signs and symptoms of COVID-19. So we have fever, cough, difficulty of breathing, sore throat, headache, runny nose, diarrhea, nausea or vomiting, weakness or fatigue, loss of appetite or taste, loss of smell, muscle or body aches. So in case you have signs and symptoms of COVID-19, so you have to immediately consult emergency department or employee health for proper assessment. The risk factors, so if you have direct physical contact with a COVID-19 case, if you are providing direct care for patients with COVID-19 without proper PPE, if you travel from abroad within the last 14 days, and if you travel from or reside in local areas with COVID-19 cases. To screen patient's companion and patient, Makati Medical Center creates a screening form. This is to help our staff in screening patients and companions who might have COVID-19. So this is used in all centers of our hospital, the screening form. Okay, so how do we prevent COVID-19? Number one is we have to wear face masks at all times. Wearing of face mask is now a mandatory. Everyone should wear masks in common areas such as the lounge area, office or workplace, color room, lobby, patient care areas. Face mask is also recommended to use at home. How to put on, use, take off, and dispose a mask. So as a general rule, before we wear our PPE, we have to perform hand hygiene. Thus, before you wear your mask, you have to perform hand hygiene. You can use either our alcohol or soap and water. The mask should cover your mouth and nose and make sure there are no gaps between your face and mask. Replace the mask with a new one as soon as it clumps, and do not reuse single-use masks. You can use disposable masks in a day or within your shift. For cloth face masks, it should be washed every day. Do not touch or adjust the mask. To remove the mask, you have to remove it from behind. Do not touch the front of the mask. Discard immediately in a bin. PPEs are discarded in the yellow waste bins. Perform hand hygiene after removing your mask. Here are the examples of ineffective use of masks. Please remember that masks should be properly worn for it to be effective in preventing COVID-19. It should cover both your mouth and nose. Due to COVID-19, we required PPE based on your workplace. So for corporate offices, so if you are working in a corporate or back offices, you have to wear surgical masks or cloth face masks. If you are working in the registration area or front desk, you have to wear surgical mask and face shield or goggles. For outpatient centers, you are required to wear surgical mask and face shield or goggles. If you are working in a regular non-COVID-19 inpatient areas, you have to wear surgical mask and face shield or goggles and wear additional PPE like precaution gown and gloves for patients on contact precautions. If you are working in a regular non-COVID-19 intensive care unit, like the medical surgical ICU, you have to wear surgical masks and face shield or goggles. Wear additional PPE like precaution gown and gloves for patients on contact precautions. Wear N95 respirator for aerosol generating procedure and inside the airborne infection isolation room. If you're working in a regular surgical units, wear surgical mask and face shield or goggles. Wear surgical mask, face shield goggles, hair cover, water-resistant gown, and gloves. For COVID-19 areas, including the emergency department, hot zone, COVID wings, COVID ICU, ICTR of OR and DR, you have to wear properly fitted N95 respirator, covered with a surgical mask, water-resistant gown, coverall, face shield or goggles, hair cover if not using coverall, and hoodies or hood cover.